Hi, I'm Ann Lukens, and I'm a social worker and paramedic, and I'm 49 years old. Yep, I'm a woman of that age. And that's okay. I've been very lucky to have some older friends who've been my menopause training team. And of course, I have some training and knowledge of my own from my profession. Now I want to share some of that information and support with you. We all expect to go through a phase of menopause symptoms, like night sweats and irritability, for a while. But there is one change that occurs during menopause that is permanent: the reduction in the hormone estrogen available in our bodies. Having less estrogen available to our vaginal tissues causes a number of symptoms that are collectively referred to as vaginal atrophy. It can range from very mild and hardly noticeable to causing pain and numerous bladder problems that interfere with everyday life and can prevent you from having a satisfying sexual relationship. The symptoms of moderate to severe vaginal atrophy include dryness, itching, thinning of the vaginal walls, possibly infections, bleeding after sex, pain and burning during sex and urination, urinary tract infections, and a shortening and tightening of the vaginal canal, which can make sex painful or even impossible. Estrogen is the key to a healthy vagina. It provides for moisture, elasticity, good circulation, and healthy muscles. The ovaries are our source of estrogen. As we enter perimenopause and throughout postmenopause, our estrogen supply will continue to diminish, causing increased dryness and loss of elasticity in the vaginal tissues. Breastfeeding, radiation and chemotherapy, and surgical removal of the ovaries can cause the same symptoms in much younger women. Studies have shown that women like me, who had a cesarean section and have never delivered a baby vaginally, may experience vaginal atrophy to a greater degree. Now, all women experience menopause to a different degree. Hot flashes, night sweats, mood changes, changes in sexual desire are very common. These symptoms are almost always temporary, and they will pass. But vaginal dryness and atrophy continue to occur throughout the rest of life. For some women, a lubricant used during sex is the only remedy they will ever need. Others will find their vaginal atrophy symptoms to be far more complex and cause far more difficulties for them. Medical surveys have shown that 10 to 40% of women will experience problems with vaginal atrophy, but only 25% of those women will seek medical intervention. Untreated vaginal atrophy can lead to vaginal infections, painful intercourse, bladder problems, and even a total loss of bladder control. Ladies, we're living longer than ever. Today's woman can expect to live 1/3 of her life after menopause. We are healthier, more active, and can have a satisfying sex life as long as we want to. Even for women who do not have a sex partner currently or feel that the sexual phase of their life is completed, maintaining a healthy vagina is important for preventing infections and bladder complications. Our mothers and grandmothers did not have the options that we have today for treating the symptoms of menopause and vaginal atrophy. From over-the-counter lubricants and moisturizers, to local creams and pills, to an estrogen ring, and even oral estrogen, there's a wide variety of options available to alleviate the symptoms and still keep hormone supplementation to a minimum. I strongly encourage you to talk to your family practice doctor or gynecologist and go over the symptoms that you're having with them. Do not try to treat yourself by going out and buying over-the-counter preparations. Let your doctor screen you and make sure there's no other medical condition causing your problems, and then they'll help you to choose the remedy that will work best for you. Thanks for listening, and take good care of yourself.